Did you know menstrual cycles can significantly impact a woman's mental health and sleep patterns? That's the focus of our exploration today. It's a topic that is not often discussed, but holds enormous relevance in the lives of women globally. A recent study conducted by the University of East Anglia, Baylor College of Medicine, and the University of Houston is shedding new light on this subject. These researchers have delved deep into the intricate dynamics between menstrual cycles, emotional states, and sleep patterns. They have revealed that women experience significant sleep disturbances and heightened feelings of anger in the days leading up to their menstrual period. This research holds groundbreaking potential, providing a fresh perspective on the relationship between hormonal fluctuations and women's well-being. So, are you ready to discover more about this fascinating study and what it could mean for women everywhere? Stick around to find out more about this intriguing intersection of biology and psychology. The study, published in the Journal of Sleep Research, sheds light on the complex dynamics between menstrual cycles, emotional states, and sleep patterns. A team of brilliant minds from the University of East Anglia, Baylor College of Medicine, and the University of Houston rolled up their sleeves and took on the task. They wanted to understand how menstrual cycles could potentially impact women's mental health and sleep patterns. The study focused on 51 healthy women between the ages of 18 and 35. These women were not on hormonal contraception and had regular menstrual cycles. The researchers used an innovative approach called ecological momentary assessment, or EMA, to track the sleep and emotional states of these women. Through this, participants were asked to submit daily reports on their emotions and sleep quality. In addition to this, the women wore devices called ActiWatches over the course of 2 menstrual months. These nifty little devices monitor sleep and wake patterns, providing an objective measure to complement the participants' subjective reports. This combination of self-reporting and objective monitoring allowed the researchers to gain a comprehensive understanding of the women's sleep patterns and emotional states throughout their menstrual cycles. Dr. Joe Bauer, one of the study's co-authors and a member of the University of East Anglia's School of Psychology, emphasized the importance of this research. She said, "Our research provides valuable insights into the complex interplay between menstrual cycles, emotions, and sleep, and the impact of hormonal fluctuations on women's well-being." The goal was clear: to better address the unique needs of women in terms of sleep health and emotional well-being. By understanding how these factors interact, the researchers hoped to provide a pathway for interventions and treatments aimed at enhancing sleep quality and emotional resilience in women. And what they discovered was quite revealing. They found striking connections between the menstrual phases, sleep quality, and emotional states. But we'll get into the details of those findings in the next part of the video. The results of this study were quite revealing. Let's dive into those next. The researchers found striking connections between menstrual phases, sleep quality, and emotional states. The study closely tracked the sleep patterns and emotional states of 51 healthy women, all between the ages of 18 to 35, who had regular menstrual cycles and did not use hormonal contraception. They used an innovative method known as ecological momentary assessment, or EMA, where the participants submitted daily reports on their emotions and sleep quality. To ensure the accuracy of the data, they wore ActiWatches, which are devices that record sleep and wake patterns over 2 menstrual months. What they discovered was a significant correlation between the menstrual phases, the quality of sleep, and emotional states. As the women approached and reached their menstrual period, their sleep patterns began to change. They reported increased time awake at night, indicating that they were having trouble falling asleep or were waking up more frequently during the night. Their sleep efficiency, which is the ratio of the total time spent asleep to the total time spent in bed, also decreased. But the changes weren't just physical. There were emotional changes as well. During this same period, the women reported a rise in feelings of anger and a decrease in positive emotions such as happiness, calmness, and enthusiasm. These changes in sleep patterns and emotions were not random or isolated incidents. They were directly linked to the menstrual cycle, providing a clear indication that the hormonal fluctuations that occur during this time can have a profound impact on a woman's sleep and emotional well-being. These findings contribute to the evidence that menstrual cycles could significantly influence women's susceptibility to insomnia and mental health challenges. The researchers' findings underline the intricate relationship between hormonal changes, sleep, and emotions, and how these elements interact to affect a woman's overall well-being. These findings are not just interesting from a scientific perspective. They have real-world implications for women's health. In essence, this groundbreaking study carries profound implications for understanding, addressing, and treating sleep disorders and emotional distress in women. It's not just about recognizing that menstrual cycles can disrupt sleep and heighten feelings of anger. It's about understanding how these changes can impact a woman's daily life and overall well-being. The hormonal fluctuations that occur throughout the menstrual cycle can make women more susceptible to insomnia and emotional distress. This susceptibility can in turn have a ripple effect on other aspects of their lives. Poor sleep quality can lead to fatigue, reduced productivity, and even compromised immunity. Heightened feelings of anger and reduced positive emotions can impact relationships, work performance, and mental health. But with understanding comes the ability to intervene. By acknowledging these cyclic changes and their potential impact, we can start to address these issues in a more targeted and effective way. This could involve adjusting sleep hygiene practices to better accommodate for these fluctuations. It might mean incorporating stress management techniques or emotional resilience strategies during certain times of the month. For health professionals, this study underscores the importance of considering hormonal fluctuations when diagnosing and treating sleep disorders or emotional distress in women. It's not enough to treat these issues in isolation. A holistic approach, one that takes into account the unique hormonal landscape of each woman, is necessary. For women themselves, knowledge is power. Understanding the interplay between menstrual cycles, emotions, and sleep can empower women to take proactive steps towards managing their sleep health and emotional well-being. It can help them make sense of their experiences, validate their feelings, and guide them in seeking appropriate support and treatment when needed. In the grand scheme of things, this research is a stepping stone towards more personalized and effective healthcare for women. It's a reminder that women's health is unique and intricate, deserving of nuanced understanding and care. This research opens up new pathways for interventions and treatments aimed at enhancing sleep quality and emotional resilience in women. To recap, menstrual cycles can significantly impact a woman's mental health and sleep patterns. It's not just a matter of physical changes and discomfort, but a complex interplay between hormones, emotions, and sleep that can influence a woman's overall well-being. Let's take a moment to revisit the key points we've discussed. A recent study conducted by a team of researchers from the University of East Anglia, Baylor College of Medicine, and the University of Houston has highlighted how women experience significant sleep disturbances and heightened feelings of anger in the days leading up to their menstrual period. These findings, published in the Journal of Sleep Research, offer new perspectives on how menstrual cycles, emotional states, and sleep patterns are intertwined. The study followed the sleep and emotional states of 51 healthy women, aged between 18 and 35, who had regular menstrual cycles and did not use hormonal contraception. Using the ecological momentary assessment methodology, the participants submitted daily reports on their emotions and sleep quality, while also wearing ActiWatches to monitor their sleep and wake patterns over 2 menstrual months. The researchers discovered a strong correlation between menstrual phases, sleep quality, and emotional states. It was found that women reported disrupted sleep patterns, including increased time awake at night and decreased sleep efficiency in the days leading up to and during their period. This period was also marked by an increase in feelings of anger and a decrease in positive emotions, such as happiness, calmness, and enthusiasm. These findings add to the growing body of evidence that menstrual cycles can influence women's susceptibility to insomnia and mental health challenges. They highlight the importance of considering hormonal fluctuations when addressing sleep disorders and emotional distress in women. This study has implications far beyond the academic setting. It suggests potential pathways for interventions and treatments aimed at enhancing sleep quality and emotional resilience in women. By understanding how these factors interact, we can better address the unique needs of women in terms of sleep health and emotional well-being. In conclusion, we need to recognize that menstrual cycles are more than just a physical process. They can significantly affect a woman's mental health and sleep patterns, and these effects can manifest in various ways, such as sleep disturbances and heightened emotions. By acknowledging these impacts, we can develop better strategies to enhance women's sleep health and emotional resilience. The importance of this research cannot be understated. It's not just about understanding the effects of menstrual cycles on women's health. It's about empowering women with the knowledge they need to take care of their sleep health and emotional well-being. Understanding these effects is the first step in improving women's sleep health and emotional well-being. Thanks for watching, and remember to take care of your sleep health.